Welcome to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Now here along with Dr. Bonati, your host, Kimberly Brumell.
Thanks for listening to American Medicine Today. I'm Kimberly Brumell, joined by our friend and executive radio producer, Ethan Euchre.
I am here.
Our other friend over here, Jeff Wagstaff, our senior fellow.
Present, accounted for. Nice to be here. Thank you.
Glad to be a friend.
And across from me,
the enemy.
Friend of our show and world-renowned orthopedic
Probably.
surgeon, Dr. Alfred Bonati of the Bonati Spine Institute. Thanks for sharing your time with us.
Thank you for introducing me.
Well, you know, we talk about Dr. Bonati's background. You know, he was one of the first in a group to learn arthroscopy from Wake Forest University. And he was one of the first to implement those procedures into the knee, into the shoulder, in all different joints, correct?
Yeah.
Okay.
We learned the knee, and after the training, we decided to go and use the other joint that was at the same time the shoulder, and we have a tremendous good results from that time. The arthroscopic surgery just progressed to all the joints.
Right, but it was you that had the foresight and the forethought to go, hey, if it works here,
Where
how
else
can
would
I
it
get
work?
that to work on the spine? And that's through that process, and I think it took years from what I understand, but he started off in invasive spine surgery, and he didn't like any of the results because there was such a high failure rate. That bothered him. He got into these other areas with arthroscopy, and he did amazingly well. One day, all of a sudden, it came to his mind how to pinpoint the root of the problem, how to be able to access those points in the spine, and he did it. And those procedures are patented and exclusive, and they're called the Bonati spine procedures. He developed the instrumentation and the methods to bring relief to the masses, and that's why Bonati succeeds where others fail. He gets to the true root cause of the problem, and he helps to have the patients regain their strength and get back in motion.
And the great thing about the fact that Doc's procedures are patented means no one else can do them.
Nobody else
in the world.
Nope.
It's one of a kind.
Yes.
So why would you? We always say others imitate, Bonati innovates.
Yes.
Well, because he really does, and everybody else, when you're the leader of the pack, like Doc is,
They try to ride the coattails.
Yeah, they try to follow your draft like they do in NASCAR.
Too bad they're not doing it properly, though.
They're not.
Otherwise, they would have the same amazing results that he gets. And it's true, the treatment at the Bonati Spine Institute is unlike any other. With that said, we have a jam-packed show. We have Jacqueline Darna, an anesthetist and CEO of Darna and Company, LLC, and inventor of the No Mo Nausea Band. She's going to be on to discuss the latest Zofran lawsuits.
Yeah, she's coming in studio. If you're a pregnant woman who, if you're unaware, there is a lawsuit
Yes.
regarding Zofran, and it was a drug that was prescribed. We'll get into all of that, but she's invented a band
Yes.
that can help combat nausea. It's pretty cool.
And Greg Kokome, he is a
He's like the lead surgeon at the Hawaii Eye Surgery Center.
for bionic eyes.
And they did a bionic eye implant into a 72-year-old woman who could barely see, turned it on, and we'll get into it. But
Amazing
That's
stuff.
interesting.
It's pretty.
An electric eye.
It's pretty cool.
Yeah.
Bionic eye.
Yeah. And I feel like we should have the theme from the Bionic Woman or something in the background. And then we're going to hear what's new in American medicine today. But up first,
In today's Back to Life segment, we will talk to a patient of the Bonati Spine Institute who went from living a life that was restricted by pain and discomfort through their journey of finding the Bonati Spine Institute and are now living pain-free.
well, it's my pleasure to introduce to the program Stuart McKenzie, who had surgeries at the Bonati Spine Institute, and he lives in Lafayette, Colorado. Well, thank you for joining us.
Oh, thank you.
Well, you have an amazing journey, so why don't you tell us how you came to be in pain? Was it an accident, something degenerative in nature, and how long were you suffering in that pain? What was it like?
Well, it was I think it was a service-related injury back in '74
Okay.
or '73, and then all of a sudden it flared up in '78.
Okay.
La-di-da, and all of a sudden, I was in the hospital, in traction, la-di-da,
Ooh.
and it just didn't work.
Stuart, what do you mean by a service-related injury? Yeah, the military?
Yeah, exactly right.
Okay.
Yeah.
Okay, so you don't know exactly what happened?
I no. At that time, it didn't happen. It was about 78, I think. I bent over at my desk, and all of a sudden my right lumbar just froze up.
Ooh.
And so it was I spent 2 days in traction in the hospital. Whoopie-doo. And it settled down, but it started recurring eventually. And then within the last 10 years, actually prior to my surgery at Bonati, I would wake up at 7 in the morning and barely crawl to my walker, and I couldn't do anything until 3 o'clock in the afternoon.
Stuart, what were the doctors recommending then? Were they giving you pain medication? Was there some type of treatment? Where were you in that respect?
Well, it was the pain. It was fine until about 2.5 years ago, prior to my surgery up there, and it was. I was immobilized. You see, I was living in Florida, and I live in Boulder now, and it just. I had to come back here to get, and they wanted to cut me from my neck to my back, to my lower region.
Highly invasive.
I said, I don't think so. My wife got on the internet, and but like I said, I was out of network, so I had to pay for it.
Okay.
And I did, and it's the best dollar I ever spent.
See, now, Stuart, I can imagine we talk about invasive spinal surgery, which to me seems like something that they probably did in the Stone Age. But so it's shocking to me that they still do things like this where they want to fillet you wide open. Mm-hmm. And it was that type of.
Exactly right.
Yeah.
And Dr. Grossman said, he put. I think the incision was a 1/4 inch. There's 2 sutures. That was it.
So in other words, you dealt with that acute pain for between 35, 40 years before seeking a true resolution to your problem.
Exactly right. Yeah.
What was that? How was it affecting your daily activities?
I couldn't do daily squat. It was. I was actually the last prior to my surgery. The last 3 months prior to that, I was immobile.
Wow.
I couldn't do anything.
Oh, that's horrible. What was that?
I couldn't play golf. I couldn't go. Well, I can't go skiing because I had a hip replacement.
Yeah.
And but anyway, your clinic up there is unbelievable.
What was that experience like when you walked through the door and you had that evaluation by Dr. Grossmith of the Bonati Spine Institute? Did you feel like he understood the true root cause of your pain?
Oh, yeah. No, because it was on Sunday night that I was out in Denver getting another MRI, and I said, I'm not leaving here until I get a copy of this. I'm bringing it back to Florida with me. And which I did, and I overnighted it to you guys Monday afternoon, and Tuesday morning, one of your specialists called me and says, "You're not feeling too good, are you?" I said, "No, I'm not." And said, "So you guys had me an appointment the next day, and they did X-rays because you already had the MRI."
Right.
And Dr. Grossman said, "Well, okay, this is what we got to do." I said, "When can you do it?"
Okay.
And he said, "I think we can get you in next Wednesday." I said, "Okay, that's fine." Now, granted, I was out of network on my insurance.
Right.
But I wrote a check for $15,900, and it was the best money I ever spent.
When you had surgery, when did you start to feel a relief of your pain?
Oh, yeah, I mean, I came out of recovery, and I'm looking for my cane, and I'm going, look, I don't need this. You know? And I said, where are my pain pills? I don't need those. You know, 2 hours later, my wife and I are sitting at a restaurant right down the street on 19.
Nice.
Eating dinner.
I bet you never would have thought, Stuart, I guarantee you, prior to surgery, the way you were feeling, the way you were so immobilized, you never would have thought that just hours after surgery, you would be hanging out with your wife, having dinner right down the road on 19 from the Bonati Spine Institute in Hudson. That must have been pretty exciting.
My guess is she had you at the mall before you knew it.
Yep.
But the thing is, you know, okay, you know, we live in Apollo Beach. Now, on your surgery thing, we need to be 20 minutes within there.
Right.
You know, so we got a hotel. I'm not going to mention the name.
Right.
But they got a great breakfast. You know, I had a drain tube in, which was no big deal. And then I came up 24 hours later. They pulled the drain tube out. We went home.
Wow. So
it was fantastic.
And how are you feeling now? And based on that, if someone were to tell you that they were suffering with the same sort of problems, would you feel confident in, recommending the Bonati Spine Institute?
Oh, exactly right. I mean, it's and I met with my PCP yesterday, and she's heard about you folks. You know, she's out in Boulder, Colorado.
All right.
And so it's and I said, yeah, hey, they are tops in the gun, you know. So it's I can't you know, I mean when you called me the other day and they said, can come into the studio.
Right.
Well, no, I can't because I'm out in Boulder.
Right. Well, you said you actually bought a place in Apollo Beach, so I wasn't sure if you were here or there. But we are so thrilled that after 30 to 40 years of suffering with that sort of debilitating pain and being told...
It took care of it immediately. I mean, I couldn't, you know, it just... you know, Dr. Grossmith, and you know, I haven't met
Dr. Bonati.
Yeah, I haven't met him yet. But
well, you know, Stuart, I'm disappointed you moved to Colorado because you sound like the kind of guy I'd like to come over to the house and watch a little hockey game tonight.
Mm-hmm.
I don't do it. I used to play hockey in high school and college.
All right, Stuart. Well, we're glad that you're feeling great today.
Yes.
We're glad that you had a wonderful experience and continued pain-free living, my friend.
Thank you for joining us.
Thank you.
Okay, thank you.
Thanks for sharing your story.
Have a great day. Good man right there.
Stuart sounds like
Very
a good
nice
man.
gentleman.
Right.
Yeah, so glad. And he is just one of the many thousands of people that Dr. Bonati and the Bonati Spine Institute have been able to help. And thank you, Dr. Grossmith, because you had the proper execution of the Bonati Spine procedures. You're listening to American Medicine Today. After the break and in studio, we'll speak with Jacqueline Darna to talk about the latest Zofran lawsuit and a product she invented called the Nomo Nausea Band. Stay tuned.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle. Those surgeries gave me my life back.
Already, I feel like a new person.
I'm going home new. I can chase my grandbaby now. I can garden, I can cook, and I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact, I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Brumell.
You're listening to American Medicine Today. I'm Kimberly Brumell, joined by our executive producer, Ethan Euchre.
Here as always.
We have world-renowned orthopedic surgeon in studio with us. And as well in studio, we'd like to welcome anesthetist Jacqueline Darna.
That's a hard word to say.
Exactly. That's why I wanted to get that one out first. She's CEO of Darna & Company, LLC, and inventor of the No More Nausea Band. And alongside her is Dr. Alfredo Orbegoso. He's an anesthesiologist.
Hello.
Welcome, guys. Welcome.
Thank you.
Thank you so much for having us.
So, Jackie, we're going to get into, obviously, the No More Nausea band, but what really caught our attention, especially Kimberly, because it touches her on a personal note, is that Zofran, right, was basically prescribed to a lot of people. Back in 1991 is when it sort of came out, and it was used for chemotherapy. It was used for post-surgery anesthesia, nausea, and it worked really, really well. Apparently, at one point, it was like the 21st most prescribed drug in America. Well, then they thought, who else can we prescribe this to?
Right.
Pregnant women.
Yeah.
Because they get morning sickness.
Horrible, horrible morning sickness. I had tried many other things, and the only thing that put the kibosh on it was Zofran. I had a scare when my daughter was born. We almost lost her because she ended up having some heart problems. All of a sudden, lo and behold, I'm watching some TV, and if you were prescribed Zofran while you were pregnant and your child had heart problems, give us a call. You know, the class action lawsuit. And I think, oh my God, I wonder if that's what the root cause of her problems were. And she almost died.
Absolutely. So Zofran targets one receptor in the brain as well as one receptor in the abdomen. And the side effects that have been well known and well published for any age group, regardless, and contraindicated in some, is the fact that it basically prolongs the heart wave, so the QT prolongation. And in infants now, they're also finding a very big similarity between cleft palates of children that are being born by mothers who are taking it consistently for hyperemesis gravidarum as well as for just the occasional morning sickness. So when my product, which again, the No More Nausea Band came out, it is a drug-free way to help reduce not just nausea and vomiting during morning sickness, but as well as to help relax the stomach instantly, utilizing essential oils of peppermint. So again, the fear, just that taking away the fear of actually having moms that they're afraid. I have 2 children of my own, and coming out now when we take a look in retrospect, the FDA is actually contraindicating. It's actually putting its advisory warnings out stating mothers that are pregnant should not be utilizing it. So now the OBGYNs, not just in this area, but globally, are saying, what can we give? Well, the No More Nausea Band is here to be able to help eliminate that fear and anxiety.
Well, you mentioned, and forgive me because I don't know the medical term by it, but once you start getting sick, it's just like a knee-jerk reaction where you feel like you have to keep throwing up, and it's almost like your stomach is in spasms. And I believe that's a side effect that you said your No More Nausea Band helps alleviate.
Absolutely. Yeah. So we're going to start with, there's 3 principles that actually show to help decrease nausea and vomiting instantly.
Okay.
The first is the fastest acting. We've learned that the fastest way to your brain is through your nose. So the peppermint aromatherapy can actually be smelled. And in medicine, we've learned that peppermint oil is actually a calcium channel blocker to the smooth muscle of the gut. What that means is it relaxes the stomach, even if you're already retching.
Okay.
You can actually watch this during endoscopy procedures where they take a camera, and after smelling my band for 30 seconds, it's amazing how you see the stomach actually relax. The secondary effect.
Just to pause for a second on the peppermint topic. I mean, we've all known for a while that peppermint is really good for the digestive tract. Like my wife has upset stomach a lot, and she drinks peppermint teas, and it seems to help. So it's just kind of odd to me that it would actually work just through the vapor as well, rather than even ingesting the peppermint.
That is correct. And then within about 2 minutes of actually wearing it, because it is a band, it is a stylish wristband, it's waterproof, you actually get transdermal peppermint. So the oils itself are completely submerged inside of this non-latex band. So you actually accumulate in the highest concentration, which is your gut. It also helps the vessels that surround your arterioles and venous system. So it actually helps to reduce headaches, like if you have really bad headaches too. And then the third, the most utilized in Eastern medicine practice, is acupressure. Acupressure at the P6 point of the human wrist, which is found in between the first 2 tendons, about 3-finger distance above the wrist. And that actually has been shown at constant pressure stimulates the nerve that lies underneath of it to produce hormones. These hormones are there to awaken the system, saying, hey, I must not be nauseous, and they're translated as anti-nausea hormones. Our Chief Medical Officer, Dr. Orbegoso, can speak a little bit on behalf of the neuromodulation portion of our actual product.
Yeah, it's she always leaves me very little to say. But in any instance, really clinician, I'm a clinician, I'm not a scientist, but basically to explain something like this is almost what people call it sometimes neuromodulation. You get hurt, what do? You rub it.
Right.
And doing this, you're having neurotransmission to the brain, confusing the painful event that you're trying to subdue or diminish. Well, this is basically what happens. They always wonder, well, what acupressure does. They've done blood levels on patients that read that, and they see there's a lot of beta endorphin that increases. Those levels of beta endorphins increase in enkephalins in the central nervous system. All of those neurotransmitters basically increase activity or traffic basically around the area of around the medulla or so, which is the chemotactic receptor zone. That's a nausea starting mechanism that if you stimulate it enough, you will stimulate vomiting.
Yeah.
So people think, well, is it going to work for this nausea? Is it going to work for this other nausea? Nausea is a mechanism that we have. You get an animal or a specimen, you put a needle in that area, you start seeing effects, and then they start heaving.
Really?
You remove the needle, it's gone. So basically, this kind of things help increase the transmission in the area to decrease the sensation of the retching and the vomiting and so, regardless of the cause.
So the No More Nausea Band can be utilized not just for post-operative anesthesia, where we have a lot of ambulatory surgical centers and hospitals that actually customize their names on the band, but as well as for post-operative, for chemotherapy,
I was going to ask you that.
Morning sickness,
Yep.
absolutely.
It can be used for
altitude sickness even, not just seasickness, car sickness for little kids. And again, you're giving a drug-free approach.
All right, so
nomonausea.com.
What is the cost?
The cost is only $11.99. It's found online at nomonausea.com.
Okay. And then I just have one quick question. Do the oils, do you have to buy them every so often? How long does it remain
One
infused?
package is good for 1 whole month of anti-nausea.
Wow. Well, thank you so much.
As you see in our practice, we practice with patients that they are going to be practically treated without going to sleep in surgery. But sometimes we have a situation that we have no choice. We need to be, some patients are scared or something like that. So we put them a little bit more deeper for the time being till make them more comfortable. What I found in these patients that they go a little bit deeper in recovery room, they are retching. They are correct. With nausea, and they feel more uncomfortable. And they say the worst part of everything was the post-op, because the surgery was okay, but when I was in the recovery room, took me 2 or 3 hours to control the sensation of nausea.
Well, no mo.
Yeah, well, and I'll tell you this, I like that you send your representative to my place, and we are going to try your product, and we will replace medications that we use for nausea for what you're using it.
Absolutely, and especially because they're face down, they can smell it, and it decreases their anxiety.
Yeah. This should be thought of a very good adjuvant. Not necessarily a replacement for what we have, but it's actually can be concomitantly, and if it's not fully work on somebody, you can see at least that there's a decrease of medication you needed to control the situation.
All right.
Yeah,
Got it.
should do. Yes.
Well, thank you both so much, Dr. Alfredo Orbegoso and Jacqueline Darna. Thank you for joining us and telling us more about nausea.
Thank you so much for having us.
Thank you. Appreciate it.
Thanks, you.
Guys.
Well, you're listening to American Medicine Today. Stay tuned because we have Greg Kokome, if I'm pronouncing that right.
Kokome, yeah, this is really cool. You're going to want to stick around. He's based out of Hawaii. They did a bionic eye implant into like a 72-year-old woman.
Yes.
It's pretty incredible. You want to hear about that.
Unbelievable stuff. Stay tuned. We'll catch you on the flip side of the break.
Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already, I feel like a new person.
I'm going home new. I can chase my grandbaby now. I can garden. I can cook. And I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact, I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonatti Spine Institute, featuring the internationally acclaimed inventor of the Bonatti spine procedures, Alfred Bonatti, MD. Once again, here are Dr. Bonatti and your host, Kimberly Bermel.
Thank you for still listening to American Medicine Today. I'm Kimberly Bermel, joined by our friend and executive radio producer, Ethan Euchre.
I'm glad to be here.
Yes.
Mm-hmm.
And And this gentleman over here is our highly esteemed senior fellow, Jeff Wagstaff.
Thank you. Glad to be here.
Mm-hmm. And we have world-renowned orthopedic surgeon Dr. Alfred Bonati of the Bonati Spine Institute.
He's just a senior without fellow.
You are the fellow.
You are our greatest fellow.
You are the fellow.
Yes, he is.
The senior.
Well, we have on the line Dr. Greg Comey, lead surgeon at
Kokame.
Kokame?
Yes.
Oh, no.
Yep.
Kokame. I'm so sorry I slaughtered your name. Please forgive me.
You're never going to get a bionic eye implant from him for messing up his name.
Oh, no. A lead surgeon at the Hawaii Eye Surgery Center in Honolulu. This is so amazing.
Yeah,
he recently performed one of the first, get this, bionic eye implant surgeries on a 72-year-old woman to help restore her vision. So thank you for joining us, Dr. Kokame.
Thank you very much for having me. Aloha from Hawaii.
Aloha.
So, Dr. Kokame, this is really interesting technology. Tell us first, before we get into what the implant is, tell us about the patient, her age, a little bit of background of what was wrong with her, and why she became to be your first candidate for this implant.
So sure, she's a 72-year-old local Japanese-American lady who has a disease called Usher syndrome. So it's a combination of retinitis pigmentosa and blind and hearing problems. So she actually went deaf, and now has developed progressive vision loss to the point where she lost her vision about 2 years ago.
Is this procedure only for retinitis pigmentosa, or also you can use in macular degeneration?
So very good question. Right now it's approved for retinitis pigmentosa, which is a hereditary retinal disease that takes away the photoreceptors in the retina over time. And it's only approved for that indication. There are studies going on now, starting in England, to evaluate whether or not this procedure could be utilized in macular degeneration, but it's just starting.
Interesting. So you found this woman. She came to you. Now tell us about the bionic eye. Where did that come from? Who developed it? How does it work? Tell us all about it.
Mm-hmm.
Yeah, so the bionic eye is actually the brainchild of Dr. Mark Humayun, who's at the USC Eye Institute, and a very good friend of mine. And he actually had the idea. He told me this story. He had the idea about 27 years ago when he was a medical student, and it's taken him 27 years to bring it from idea to development of technology to going through clinical trials to now it's been FDA approved since 2013.
It's funny how often that happens, where the idea comes and then the technology isn't even there yet, because the idea is so far ahead of what is present at the time.
Yeah.
That's incredible. So how did he develop it?
Well, he developed it. Well, he also has a biomedical engineering degree, in addition to being a doctor and a retina specialist and a retinal surgeon and a professor. He's done all that, but he worked with Caltech. Mm-hmm. And the people at Caltech helped develop the electronics within the system.
So let me ask you something. This is a microchip that's implanted, and it has to work in conjunction with special glasses. Is that just to start the process, or do you need both to be together for it to work?
Yeah, the interesting thing is that, so we don't have photoreceptors in our eye, unfortunately, when you have retinitis pigmentosa. So you need to replace the visual input. So the camera is actually creates the visual image, or actually gets the visual images, and it's on the patient's glasses, and then it's sent to a device that will wirelessly communicate to the coil on the outside of the eye, and the coil on the outside of the eye then communicates to the microelectrodes on the inside of the eye on the retina. Those electrodes will then stimulate the retina, and then it goes to the retina, to the optic nerve, and to the brain.
Wow.
When I saw the idea in University of Miami, and I saw the drawings of the project for the eye, the glasses were extremely big and heavy. Is that still the case, or this time the glasses are just something like routine glasses?
Well, they're actually, most people choose, because they don't see, they choose the dark glasses.
Yeah.
So now they're much smaller, and they actually, to be honest, they actually look kind of cool. They're sunglasses.
Oh.
And it actually looks pretty good on the patient.
Wow.
So it's actually much less cumbersome than before, and it actually looks kind of cool. And interesting, you mentioned the University of Miami. I have Florida ties. I trained at the Bascom Palmer Institute in Miami.
Well, when I saw the project, the glasses was almost the size of the head of the patient, and I looked and I said, "This is something that I never will be able to use." I mean, I thought they would modify, but now it seems to be that the chips and all the things that they created, they are making the thing easy, and I'm so happy to see that the glasses now they are something cool.
Yeah, they actually look cool.
Yeah.
When you're talking about the chip again, and you said one wirelessly connects to this thing on the eye, I mean, can you tell on the individual themselves, do they have anything that's maybe outside their skin near their eye?
Yeah, what does it look like? I'm trying to picture it in my head.
Or do they look normal?
So actually, once we implant it, you can actually tell that. You cannot actually tell that it's there.
Okay.
But it's like when we do a scleral buccal surgery, which is a surgery for retinal detachment, we put something on the outside of the eye. It's like a girdle that goes around the outside of the eye.
Mm-hmm.
The same thing with this is electronics are kind of on the outside of the eye, like a little, and then we have a band that kind of goes around the eye like a girdle. And once everything heals, you can't see that the electronics are on the outside of the eye. They're actually covered very nicely. So our patient, when we did the first surgery, really amazingly hardly had any swelling and really could hardly tell even right after surgery. And then after everything heals, you don't know that it's there.
Oh, this goes outside of the eye, and it's in the future. Do you think it's going to be placed directly in the retina?
Well, no. So the electronic casing is on the outside of the eye.
Okay.
But it's on the outside of the eye. By outside of the eye, I mean outside of the eyeball. It's still underneath the white part, the conjunctiva of the eye.
Oh, so it's
and the
totally
microelectrode goes inside the eye, and the microelectrode array goes on actually the surface of the central retina called the macula.
Okay, all right.
That's incredible.
So unbelievable.
It's like science fiction
Yes.
comes to life.
And what is the vision like for people that have this implant? I mean,
Exactly.
are they seeing 20/20? Is it just
No.
shades of gray?
What's the process?
Yeah.
Well, it's actually not the kind of vision that you or I would know. So it's artificial vision, but they can actually, they go from being in a world of total darkness, and then they can go to actually navigating through a room, seeing things in front of them. They can tell a fork from a plate. There's been some really amazing videos posted on YouTube where you have a patient that's shooting an arrow, and you also have a patient that's shooting baskets and making 5 out of 7 in this little indoor basketball area.
That's better than I could do.
Unbelievable.
So it's really pretty incredible what they can do with it.
Yeah.
This entire process is incredible. When you say they see differently, I'm picturing like, I don't know if this is a fair example, but I'm picturing almost like a video game or something that you would see animation almost. Is there any way to describe
we're not
what
exactly
they see?
sure what they see since we're not them.
Right.
Yeah.
But we can kind of imagine
movie.
it. They're kind of seeing like lighted images and stimulation.
Is
And
this-
the amazing thing is that, you only have 60 electrodes. Usually we have millions of photoreceptors. Only with 60 electrodes, the brain fills in so much that it can process the information and then provide us with useful data. That's the amazing thing.
There was a movie, and I believe it was in the 80s, where there was some sort of implant or device where the person, like you said, Jeff, was almost looking at like a video game or something, but the images was there, and it was a scary movie, so they were supposed to like see a killer or something like that. But it was weird because they didn't have the normal vision and how they had to react to that. Now, hopefully, she's never in that position,
Right.
but. What is that process like? Because obviously you don't insert it, flip a switch, and it starts working. So how long does it take to process, I guess, the new vision? And how is it months, weeks to where they're able to see more normally?
Well, that's very good, very important point. Exactly what you said. You don't just turn the camera on and they see.
Right.
That's not what happens. So we turned the camera on for our first patient about 2 weeks ago.
Mm-hmm.
And the very first day, we have a training system where we can actually project images on a screen in front of her.
Mm-hmm.
And we were trying to get her to see a big square or a big circle. And the funny thing is, we were moving the operator was moving a mouse around, and it has a little arrow on it. And she couldn't find the square. Then she started just picking out where the mouse arrow was.
So she
I thought it was just incredible. She kept on pointing to the mouse, and they go, "Oh, she's missing it." And I go, "No, she's picking up the mouse."
The movement. That's interesting.
That was amazing. And then we actually shined a light at her, and we asked her to try to walk to the light, and I was holding the light, and she actually walked to me. So that was an incredible experience to see that.
God bless you for what you're doing.
And these patients are patients that they were able to see before, or these patients that never saw before? They never had vision before.
Very important point. So she did see before, and actually we want people to have at least seen before, so they can interpret what they're seeing. So she lost her vision completely about 2 years ago, but before that she could see, and she's 72. So
okay, then when you ask her the comparison between what she saw before and what she sees now, is any difference, or is what she said?
Well, unfortunately, she's blind and deaf, so they have to communicate with her through this. It's something I've never seen before, but it's like a touching signing mechanism where actually they do amazingly well, but it's not just signing by hand, of course, because she can't see. You can't just talk to her because she can't hear, so it's a touching signing. So that's all. It's hard to get an idea of what she would respond to that.
One quick question: is she seeing color or shades of gray?
Or do you know?
Well, the amazing thing is she was initially, when we turned it on, she was describing that she could see color, like blue or green. And the people from Second Sight, is the people that make this, said that may mean that she does have some cone function. Cone function is the photoreceptors that assess color. But in general, we don't have color vision yet with this device. That actually is a goal for the future.
Well, and what we're going to do is we're going to follow up with you in a few weeks, because I know you were telling me you have another patient who's going to be the second candidate that you're going to be working on coming up. So
fantastic. Thank you very much, Dr. Greg Kokme, lead surgeon at the Hawaii Eye Center, Eye Surgery Center in Honolulu.
Before you finish, is there any way that we can send the crew to your institute so they can film this, so we can promote this on television?
Yeah, well, we'd be happy to do that. We actually were on the ABC National News, I think, when we did the first procedure, but we'd be happy to accommodate.
Let's do the interview with the doctor with Hanuma Bay in the background.
That would be nice.
Yeah.
We'll set that up, Dr. Bonatti.
Okay.
All right, Dr. Kokme.
Okay, great.
Thank
you.
Aloha.
Yes, aloha.
Aloha. Thank you for joining us.
Have a great day. Incredible stuff.
I'm going there.
Absolutely. I love this technology. You're hearing it here.
Doc's got his bags packed already. He's ready to go.
Me too.
Let's go.
I think I'll use my arms and fly through myself. You're listening to American Medicine Today. Coming up next, you're going to hear what's new from Dr. Bonatti in American Medicine Today. Stay tuned.
Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already, I feel like a new person.
I'm going home new. I can chase my grandbaby now. I can garden. I can cook. And I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact, I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonatti Spine Institute, featuring the internationally acclaimed inventor of the Bonatti spine procedures, Alfred Bonatti, MD. Once again, here are Dr. Bonatti and your host, Kimberly Brumell.
Well, thank you for continuing to listen to American Medicine Today. I'm Kimberly Brumell, joined by our executive radio producer, Ethan Euchre.
Always a pleasure to be here.
Our friend and senior fellow, Jeff Wagstaff.
He's back.
And this guy is ready to rock and roll. We have world-renowned orthopedic surgeon Dr. Alfred Bonatti of the Bonatti Spine Institute. And he's going to tell us what's new in American medicine today. Bye.
Now it's time to see what Harry Reid, Nancy Pelosi, President Obama, and the Democrats have simmering in Washington, D.C. Let's see what's cooking in Barack's crock.
All right. Because it's pretty thick out there.
Smell bad.
It's a little stinky, Doc.
Mm-hmm. And
what's on your mind, Doc?
Mm-hmm.
Very stinky.
Yeah, stinky what the government does with its employees and how it helps them and how it leaves everyone else to fend for themselves when it comes to insurance.
Do you know what is really funny there?
What?
The American people is so incredible. It's not only extremely loyal, it's extremely strong, extremely, they are nice people, and they are honest, responsible, and hard worker.
Okay. Well, thank you.
This, I'm not talking about you.
You can get out. He's not talking about you at all, Jeff.
But
despite
of this, when they start to see abuse, they start to gather a response and slowly start to shift. It's very amazing to see how important it is to maintain the integrity of the country, to maintain the responsibility of the political and social system. It's not a surprise today to see that the whole country start to see these reactions of individuals in Baltimore and in other areas of the country that they are really raising hell to defend what is not acceptable in the mind of the American people. Crime is not acceptable. Looting is not acceptable. Behavior of lack of integrity, laziness, irresponsibility is not acceptable. And the people start to shift because Democrats are constantly favoring the negativity on this country. Everything that is lazy, they support. Everything that is irresponsible, they support. Everything that is crime now seems to be that is okay. They support. So when you start to see that type of an attitude, the individuals that they support the Democratic Party, that they honestly believe in some ideas of the democratic political system, they start to shift, and they start to look at, yes, but this is not what I can tolerate. I start to see, I saw friends that they are very much Democrats, and despite that I have fights with them, with the political system and the ideas that they have, they start to shift to more honesty, more responsibility. You cannot be fighting the police. If we are going to train the police to protect us, you cannot remove the responsibility that the police has. These people are practically putting their lives in in front to protect us. And if you go and you practically remove that responsibility, I feel that what's going to happen is we're going to have protection. Well, this is what I see in the political and in the social system. But now we have the same problem in the medical system. We're corrupting the healthcare, and we're destroying the healthcare. And when you see the healthcare, for example, in the government, everything that is government, they have an incredible type of insurance system that none of the American system or the American population enjoy it. They are pushing the American population to Medicaid. That is one of the worst type of insurance. It's reported by University of Pennsylvania that 93% of possibilities that some individual who goes that has an insurance of Medicaid has 93% possibilities to die.
I think that was the University of Virginia.
Oh, Virginia, okay.
But yes, they were talking about government-funded medicine versus private insurance, and they were saying if something catastrophic were to happen, you have a 93% chance of fatality.
Wow.
Yeah.
Yes.
Those are real.
I don't remember exactly where I read it, but I remember they say mortality.
Yeah.
Okay. That is spooky.
Yeah.
That is horrendously. And why? Why?
Well, why is the government pushing? It's such a multifaceted thing.
Yes.
But A, they don't want what they're making us have, and B, why are they pushing that upon the populace?
Right.
What's the motivation behind it?
But they negate themselves. They said if they were forced to do it, Obama would overturn it.
Right.
Yeah.
Well,
what's good for the goose is not.
But
good
you
for
see,
the gander.
every governmental agency has a United Healthcare and Cigna.
Right.
Okay, and the Type A insurance. Well, that insurance is being paid by us.
Right.
All right, and then you see the normal people who was before insured and they have a comfortable insurance now is under the government pushing this to Medicare.
It's unbelievable.
No, correction, to Medicaid.
Yeah. Well.
And further expansion of Obamacare. Yeah.
Correct, yes.
Well, I know that we say it every week, but it's
so much to talk
It's a
about.
problem that's going to continue, and there's
No,
not.
so the same people who run the IRS are now going to run healthcare.
Yes.
Sounds like a plan to me.
Imagine that. All right, well.
Exactly.
Just about out of time, guys.
Well, you're listening to American Medicine Today. Make sure that if you're suffering or know someone that is with headaches, neck, back, or sciatic pain, tell them to reach out to the Bonati Spine Institute. We'll help them regain their strength and get back in motion. 855-267-0482 or Bonati.com. Make sure to check us out nationally on Bloomberg, both Saturdays and Sundays, and here locally, WFTS ABC 28 at 7. We'll see you next time.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already, I feel like a new person.
I'm going home new. I can chase my grandbaby now. I can garden. I can cook. And I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact, I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.